Hello everyone and welcome to Star Health Insurance YouTube channel. I am Dr. Sridatta, consultant nephrologist and transplant physician, and today we are going to explore a very important topic, urinary tract infection, in short UTI. Did you know that the prevalence of UTIs in India ranges between 20 to 30%? A study conducted in an outpatient department found that 74% of the patients with UTIs were female, while 35% were male. If you are a woman or have a female anatomy, your chances of getting urinary tract infections are significantly higher. In fact, some experts estimate that a women have 50% chances of experiencing a UTI in their lifetime, with many facing recurring infections that may continue to occur for years. So why are UTIs more common in women? The reason UTIs are more common in women and those with female anatomy is mainly due to the shorter urethra compared to men. A shorter urethra makes it easier for bacteria to travel from outside the body into the bladder. This anatomical difference significantly increases the risk of developing urinary tract infection. So what will we cover today? In this video, we'll explore everything you need to know about UTIs. Here's the breakdown of the topics we will cover. 1. What is a urinary tract infection? 2. What causes UTI? 3. What are the symptoms of UTI? 4. How are the UTI diagnosed? 5th one, how are the UTIs treated? And finally, how can you prevent UTIs? Be sure to stay tuned until the end of the video to learn some helpful prevention tips that can lower your risk of getting a UTI. What is urinary tract infection? A urinary tract infection is an infection that occurs anywhere along your urinary system. The system includes your urethra, leading to urethritis when infected, kidneys, leading to pyelonephritis when infected, bladder, leading to cystitis when infected. Your urine is essentially a waste product created by your kidneys, which filter your blood to remove excess water and waste. Under normal circumstances, urine travels through your urinary system without any contamination. However, as the bacteria can enter the urinary tract and cause infections. Now let's quickly define the main parts of our urinary system. 1. Kidneys. These are the small bean-shaped organs located at the back of our body. They filter waste, water from your blood to form urine. The next one is ureters. Thin tubes that carry urine from the kidney to the bladder. The bladder is a balloon-like organ that stores your urine before it exits the body. Urethra, the tube that carries urine from your bladder to the outside world. Your next, what causes UTIs? The most UTIs are caused by microorganisms, particularly bacteria. Sometimes fungi can also be responsible for urinary tract infections, but these are less common. These harmful microorganisms generally enter the urinary system through the urethra. From there, they infect the bladder. If left untreated, this infection can spread upwards through the ureters to the kidney. A variety of factors can increase the risk of bacteria getting into the bladder, including sexual intercourse, which can introduce bacteria into the urinary tract. Conditions that block the urinary tract, such as kidney stones, which prevent urine from flowing freely and makes infection more likely. Incomplete emptying of bladder, seen in conditions like enlarged prostate in men or constipation in children. Urinary catheters. These tubes used to drain urine can introduce the bacteria into the bladder. Weakened immune systems, such as people with diabetes, those undergoing chemotherapy. Not drinking enough water, which can prevent proper flushing of bacteria from the urinary system. And poor hygienic practices, such as not keeping your genital area clean and dry. And even pregnancy, which increases the risk due to hormonal changes and pressure on your bladder. Next, the symptoms of UTIs. UTIs can present with variety of symptoms, some more severe than others, depending on the part of the urinary tract that is infected. The common symptoms include pain in the flank, abdomen, pelvic area, or lower back, especially when passing urine. Cloudy or foul-smelling urine. Frequent urge to urinate or urinating more than the usual. Blood in the urine, that's called hematuria, which can make the urine appear pink or cola colored. And even burning sensation during urination. Fever and chills which can indicate that the infection has reached the kidneys. In older individuals, changes in behavior such as agitation, confusion or fatigue. And bedwetting, especially in children and even in elderly individuals. If you notice any of these symptoms, it is essential to seek medical advice as soon as possible to prevent the infection from worsening. How are UTI diagnosed? To diagnose a UTI, a doctor will first take a detailed medical history, perform a physical examination, then the following diagnostic tests may be used to confirm the infection. 1. The urinary dipstick. It's a quick test where a plastic strip with the chemicals is dipped in urine to check the signs of infection such as presence of white blood cells or bacteria. Next, urine analysis. A sample of your urine is sent to a lab to be examined under a microscope. This test looks for white blood cells, blood or bacteria in the urine. Next, urine culture. In this test, a urine sample is allowed to grow in a lab to identify the bacteria causing the infection. The lab may also test different antibiotics to determine which treatment will be the most effective. Next comes the imaging tests. In some cases, your doctor may order an ultrasound or a CT scan to assess the urinary tract. Some blood tests. If a kidney infection or the upper tract UTI is suspected, a blood test might be necessary to check for the signs that the infection has spread to the bloodstream. So how are UTIs treated? The most effective treatment for UTI is a course of antibiotics. Your doctor will choose an antibiotic based on the bacteria causing the infection. Common antibiotics prescribed for UTIs include nitrofurantoin, cephalexin and ciprofloxacin. It's crucial to complete the full course of antibiotics even if your symptoms improve. Stopping treatment early can lead to recurrence of infection and increase the risk of antibiotic resistance. Some severe cases of UTI, particularly those involving the kidneys, may require hospitalization and treatment with IV antibiotics. Antibiotic-resistant UTIs are becoming a growing concern. Overuse and misuse of antibiotics, such as not finishing the prescribed course, have led to resistance. So how to prevent UTIs? We know that prevention is always better than cure. Here are some essential do's and don'ts to reduce the risk of developing a UTI. So let's talk about some do's. Wipe from front to back after using toilet to avoid introducing bacteria into the urethra. Keep the genital area clean and dry. Drink plenty of fluids, especially water, to flush bacteria from a urinary system. Wash the skin around the genitals with water before and after intercourse. Urinate after sexual intercourse to help clear any bacteria that may have entered the urethra. During menstruation, change sanitary pads regularly. Some don'ts. Avoid using scented soaps or other irritating products in the genital area. Don't hold your urine. If you feel the urge to go, urinate as soon as possible. Don't rush when urinating. Make sure you fully empty your bladder each time. Avoid tight-fitting clothing, which can create a moist environment ideal for bacterial growth. If you use diaphragm for birth control, consult your doctor as it may increase the risk of UTIs. To sum up, urinary tract infections are a common but treatable condition. While it might feel embarrassing to talk about symptoms affecting the genital area or the incontinence, it is important to remember that UTIs are not your fault and are nothing to be ashamed of. Most UTIs respond well to treatment with antibiotics, and the key to full recovery is completing the prescribed course. Thank you for watching. If you found this information helpful, hit like button. Feel free to leave a comment or a question below and subscribe to Star Health Insurance YouTube channel. Thank you.